Welcome to the Bloodborne Pathogens training course. Introduction. Topics covered include make a pact, protect, make a pact, act, make a pact, clean, make a pact, tell. Importance of bloodborne pathogen training. You may encounter blood or blood-containing materials at your place of work in the form of saliva, vomit, or sneeze droplets. Non-living materials may be contaminated with blood or blood-containing material. This course will teach you how to stay safe when you encounter another person's blood or blood-containing material. What are bloodborne pathogens? Germs present in blood that can make a person ill. Examples include hepatitis B virus, hepatitis C virus, human immunodeficiency virus, or HIV. These viruses often cause no short-term symptoms, can be transmitted to others, and can cause death. Symptoms and long-term effects. Bloodborne pathogens hepatitis B virus and hepatitis C virus have the following symptoms and long-term effects: yellowing of the skin or whites of the eyes, feeling tired, pain in the abdomen, nausea, vomiting or diarrhea, loss of appetite, damage to the liver, and can lead to death. HIV has the following symptoms and long-term effects: extreme unexplained tiredness, poor appetite with rapid weight loss, unexplained fever, swollen glands, increased chance of other illnesses, can cause acquired immunodeficiency syndrome, or AIDS. Visit the Centers for Disease Control and Prevention website for more information. How bloodborne pathogens enter the body. Being stuck with a needle or other sharp item with infected blood or blood-containing material on it, or infected blood or blood-containing material enter your eyes, nose, mouth, or an opening in your skin. Exposure to bloodborne pathogens. Exposure to a bloodborne pathogen may not cause illness because the pathogen must enter your body. Risk of illness depends on the amount of pathogen in the blood or blood-containing material that entered your body and your body's ability to fight the pathogen. Treatments can decrease your risk of illness even after exposure. Exposure Control Plan. This document includes a list of all jobs with a reasonable chance of blood exposure, a list of all tasks and procedures specific to job classifications whereby occupational exposure may occur, methods of compliance, which are rules to protect employees, hepatitis B vaccination, post-exposure evaluation and follow-up, communication of hazards to employees, record keeping, procedures for reviewing exposure incident circumstances, and annual training plans. Follow the PACT methodology. Protect yourself from blood or blood-containing material before and after exposure to keep from becoming ill. If exposed to blood or blood-containing material, take these actions. Protect yourself from blood or blood-containing material. Act quickly and safely. Clean areas contaminated with blood or blood-containing material, and tell your supervisor about the incident. Make a pact to protect. Protect yourself from exposure to bloodborne pathogens to reduce the risk of becoming ill if an exposure occurs. Follow the 4-step PACT action to help you stay safe from bloodborne pathogens. The topics covered in this module include scene safety, universal precautions, personal protective equipment, latex allergies, washing hands, hepatitis B vaccine, bloodborne pathogens entering the mouth, and recognizing symbols. Scene safety. You may have to give help in dangerous places, for example, a bleeding victim surrounded by broken glass. Do not put yourself in danger to help others as you could become a victim yourself. Always look around and check for safety for yourself and the victim. Make sure the scene is safe first. Universal precautions. If you contact blood or blood-containing materials such as urine, vomit, feces, or saliva from a person affected with a bloodborne pathogen, there is a chance you may become ill. Universal precautions include treating all blood and blood-containing material as if they contain bloodborne pathogens and performing the appropriate safety measures to protect yourself and your coworkers. Personal protective equipment. Wear personal protective equipment when helping someone who is bleeding or is around blood or blood-containing material. Blood may be splashed or sprayed, requiring one to wear a cap or gown. Check your company's exposure control plan for more details. Common forms of personal protective equipment include protective goggles, face shield, gloves, foot covers, a cap or hood, and a gown or apron. Latex allergies. Some protective gloves contain latex, and some people are allergic to it. Use protective gloves that do not contain latex, such as vinyl or nitrile gloves. If you or the injured person has a latex allergy, do not use gloves that contain latex. Washing hands. Hands are the most likely areas to be exposed to blood or blood-containing materials. Hand washing with soap and large amounts of water is the single most effective form of protection for you and others during a potential bloodborne pathogen exposure. Washing your hands correctly greatly reduces your chance of becoming ill or spreading germs to others. Hand washing action steps. Turn on the faucet with a paper towel and dispose of it properly. Wet hands and apply soap. Work a soap lather for at least 20 seconds and rinse hands with large amounts of water. Avoid splashing and keep water contained in the sink. Use hand sanitizer if soap and water are not immediately available, but wash hands as soon as possible. Dry hands with a paper towel or a high-velocity air dryer and use that paper towel to turn off the faucet. Then dispose of the paper towel properly. Hepatitis B vaccine. Employers should make a hepatitis B vaccine available to you free of charge when a reasonable chance of contacting blood or blood-containing material exists. An employer's exposure control plan identifies at-risk personnel. Your employer's site-specific bloodborne pathogen training will provide more details about this. Bloodborne pathogens entering the mouth. Because bloodborne pathogens can enter your body through your mouth, you need to be careful in any area where you might contact blood or blood-containing material. Also, it is very important that you clean your hands thoroughly and properly after handling blood or blood-containing material to reduce the chance of bloodborne pathogens entering your body through your mouth and making you sick. Recognizing symbols. Warning labels, called biohazard symbols, must be placed on containers that hold or carry blood or blood-containing materials. Biohazard symbols have a bright orange or orange-red background with lettering and symbols in a different color. Your workplace should have special areas and rules for disposing of contaminated items. These disposal areas must be marked with a biohazard symbol and may include sharps containers and red plastic bags. Make a pact, act. When there is an exposure to bloodborne pathogens, how you act in the situation will determine the effect of the exposure. The topics covered in this module include dealing with an exposure, how to remove protective gloves, sharp objects or sharps. Dealing with exposure. If blood or blood-containing material enter your eye, nose, mouth, or an opening in your skin, you must act quickly to lessen the chances of becoming ill. The exposure control plan for your workplace should have site-specific steps to follow. Ask your employer for more information. Dealing with exposure action steps. If you are wearing gloves, take them off. Immediately wash your hands and any skin that contacted blood or blood-containing material very well with soap and large amounts of water. If blood or blood-containing material have splashed in your eyes, nose, or the inside of your mouth, rinse these areas with lots of water. Tell your supervisor or other designated company representatives what happened as soon as possible. Your employer may send you to a healthcare professional for evaluation after an exposure incident. How to remove protective gloves. Action steps. Grip outside of one glove near the cuff and peel it down until it's inside out. Cup it with your gloved hand. Place 2 fingers of the bare hand inside the cuff of the other glove and peel it down until it is inside out with the first glove inside it. Avoid touching the contaminated area. Place contaminated gloves in a biohazard waste bag or in a sealable plastic bag if one is not available. Wash your hands thoroughly with soap and lots of water after removing gloves. Sharp objects. Sharps. Sharps are needles or other sharp items. May include broken glass, knives, and scissors that may have contacted blood or blood-containing material. These might include devices that people with diabetes may use to give themselves medicine. Disposing of sharp objects. Anyone can be stuck by one of these sharps. Dispose of sharps in a sharps disposal container. Do not recap an exposed needle that has contacted blood. Some needles or items with sharp points have special engineering controls that automatically cover the needle after use for added protection. Make a pact, clean. Using the right steps to clean up may help you and your coworkers from becoming ill after an exposure to bloodborne pathogens. The topics covered in this module include exposure control plan, and cleanup. Exposure control plan. Your workplace has a site-specific exposure control plan. You should ask your employer where to find a copy of it. Be sure to follow the details in the exposure control plan when you clean up after an exposure. Cleanup. Different sizes of spills. Quickly and completely clean up any blood or blood-containing material to limit the chance of bloodborne pathogen exposure. Clean small spills with a disinfectant cleaner and a cloth or other absorbent material. Larger spills will require you to first wipe up the blood or blood-containing material with a cloth or other absorbent material and use a disinfectant cleaner to cleanse the surface once the blood or blood-containing material is removed. Disposable surfaces can be discarded rather than disinfected. Cleanup. Action steps. It is important to quickly clean up any blood or blood-containing material. For cleaning any surface, you must put on the appropriate personal protective equipment, use absorbent materials such as paper towels to wipe up large amounts of blood or blood-containing material, use a surface disinfectant cleaner to clean any contaminated work surfaces, and dispose of cleaning materials and any personal protective equipment in the appropriate waste containers. Make a pact. Tell. Immediately report bloodborne pathogen exposure to your supervisor and follow your company's exposure control plan to potentially reduce your chances of becoming ill. The topics covered in this module include reporting exposures, OSHA Form 300, post-exposure care, and OSHA regulations. Reporting exposure. Immediate blood or blood-containing material exposure reporting is vital as it helps you get treatment and helps your employer identify and reduce causes of exposure. Your employer's exposure control plan lists the people at your workplace you must report an exposure to. At a minimum, you should tell your supervisor what happened as soon as possible. Your employer may send you to a healthcare professional for evaluation after an exposure incident. OSHA Form 300. Employers may need to complete the Occupational Safety and Health Administration Form 300, Log of Work-Related Injuries and Illnesses. Employers must keep employee medical records private. You or your supervisor may need to complete another form. Check your employer's exposure control plan for details. Post-exposure care. After most workplace exposures, the employer may make a confidential medical evaluation available to the employee who has been exposed to blood or blood-containing material. This medical evaluation may include a blood test for specific bloodborne pathogens. OSHA regulations. The Occupational Exposure to Bloodborne Pathogens Standard is published by OSHA. This standard defines the rules employers must follow to protect employees who may have a reasonable chance of being exposed to blood or blood-containing material in their jobs. Many of these rules are covered in this course. For more information on the standard, visit the OSHA website at the below address. Course summary. You have completed the bloodborne pathogen course. Here is a review of what you learned. Explain the importance of taking the bloodborne pathogen course. Define bloodborne pathogens. Describe the 4 main steps for staying safe when facing an occupational exposure. Discuss how universal precautions, personal protective equipment, and hand washing can protect you from infection. Recognize warning signs and labels for biohazards. Discuss how to dispose of sharps and other contaminated items. Recall how to safely remove gloves. Identify the types of spills and methods to clean them. Discuss your exposure control plan.